In our fast-paced, technology-driven world, myopia is becoming increasingly prevalent. According to global data, the prevalence of myopia has doubled in the last few decades, and it's estimated by 2050, nearly 5 billion people around the world will be affected. As myopia rates increase, so does the need for refractive surgery as it reduces dependence on glasses or contact lenses. Corneal refractive surgery has undergone significant evolution, improving its effectiveness and safety over the years. Today's young patients are notably well informed with widespread access to digital information regarding laser-based vision correction. They expect higher precision, safety, and outcomes from modern vision correction technologies. In summary, the evolution of refractive surgery reflects ongoing advancements aiming to enhance precision, reduce recovery times, and improve patient outcomes. Refractive surgeons commonly face several fears and concerns. They worry about plane identification, tougher dissection, and retained lenticules, which can affect the outcome of the surgery. But the connection amid these fears is the way lenticule is dissected and extracted. We know that more tissue manipulation leads to subclinical edema, affecting the quality of vision post-operatively. So we took a look at advanced corneal refractive surgery platforms and observed that they differ in their specific laser parameters and applications. So we decided to use this advancement in technology to patients' advantage to provide enhanced quality of vision. We first hold the lenticule gently with the forceps and exert traction radially to pull the lenticule from the surrounding stroma. But not just that, we also wanted to see if this technique is better than the conventional dissection technique. We found that patients had better quality of vision, as we can see through the objective scatter index and also through better point spread function. This technique is repeatable and more reassuring for the surgeon.